People are not, well, we all are going to die.
Probably not the first thing I would say to the people who elected me. I'm Zachary Oren-Smith. I write about politics for Iowa Starting Line. Call it an unforced error, call it a revealing moment. U.S. Senator Joni Ernst was in town for one of her rare town halls, and it's an important time for the senator since her chamber will soon consider Trump's tax bill that will cut food assistance and Medicaid. And while pundits in the media have been saying senators like Joni Ernst will make major changes before passing the bill, there's a real concern about what these changes will actually look like. Medicaid is a popular program that provides government-sponsored health care for poor Iowans and people with disabilities. The bill the House passed last week makes about $700 billion in cuts over the next decade to pay for tax cuts that overwhelmingly help the rich. But Zach, how much will it help the rich? This is you and me. This is the top 0.01%. You do the math. To find that money in the budget, Republicans are hoping to impose some barriers to entry. That includes work requirements for adults without children, even though the vast majority of these people already work, are in school, or are caregivers for family members. And then there's the system of more frequent eligibility checks with the hope of knocking more people off Medicaid rolls. The concern with these cuts and new barriers to healthcare and food assistance is you don't get to decide when you're sick. And you don't get to decide whether you're hungry or whether you get food for your children. People are concerned about the impact of this bill that's coming at a time where many of us are already struggling. These programs are set up to help the poorest Iowans. When I look for savings from the people with the yachts, it's a $3 trillion tax cut for rich people, paid for on the backs of poor families who are losing their health care and food assistance. Ernst has argued that these cuts are about getting undocumented immigrants off Medicaid. But lots of American citizens will lose access in the process. According to the Congressional Budget Office, that's a nonpartisan office that reviews these legislations, they estimate that 13.7 million people would lose health insurance by 2034 if this bill passes. Hospitals in Iowa are closing. Too many uninsured people are seeking care in last resort emergency rooms. 14% of Iowa women do not have a birthing hospital within a 30-minute drive of them.
Well, we all are going to die.
This is a time where serious people would try to find real solutions to what are real problems, not grin at the camera when the people are suffering. The bill heads to the Senate next. Whether it passes may depend on how many more awkward town halls Republicans are willing to face. For this story and more, go to iowastartingline.com and check out our podcast on YouTube. Cornhole Champions comes out Wednesday morning. We hope to see you there. Thanks for watching.